With Ultherapy, you begin to build collagen within a few weeks after the procedure, but really when it begins to show is 3 months onwards, when you begin to develop sufficient quantities of collagen to create the lifting effect. What's interesting about it is it's been shown that even up to a year after the treatment, you're still building collagen. What I want to say in this instance is the expectations of a patient need to be very clear. This is not a surgical facelift. The effect is quite subtle, slow to evolve, but what we know is with repeated treatment, the results get better and better with time. I should also say it makes a difference regarding the baseline tissues of a particular patient. So for example, we treat both Asians and Caucasians. A typical Asian patient, our skins are thicker, the dermis is thicker, that's why we have more sebum, oilier skin, more pores. We tend to have greater subcutaneous fat in our tissues, which makes it heavier when you're trying to create a lift. In contrast, Caucasian skin tends to be thinner. The dermis is finer, there's less subcutaneous fat, less volume on the face. And in that instance, it may actually be a little bit easier to see a difference in terms of the lifting effects of a non-invasive treatment such as Ultherapy. But in my view, based on our publications as well as our experience, in the end, it's always a combination that works better because, as I mentioned, aging doesn't just happen in a single layer. You want to address all of the aging changes, whether it's volume, the muscle, hydration, collagen stimulation, pigmentation, and Ultherapy works perfectly in the collagen stimulation part of the aging process.